All right. Good afternoon, everyone. My name is Honorable Uvo of Healing Hand Health Society, and today we are privileged to have Professor Oluwatoyin Onakpoya from Obafemi Awolowo University and Teaching Hospital in Ile-Ife in Nigeria. Good afternoon, Prof. How are you?
I'm good. Good afternoon, Uvo. How are you doing?
I'm fine, thank you. I've been, some people have been asking me, come on, what are you doing with eye disorders, you dentist? What are you doing with that matter? I must say, this is how I got involved. We had an outreach recently where we did just some basic eye checks, and the line for the eye disorders were overwhelming. We had to close and run away. And there's so many people who had different issues, and from what I saw, many people had, according to the ophthalmologists and optometrists who were on ground, that many, more than 40% had mature cataracts, and I was surprised. And I started thinking, what can we do to, you be a part of some solution? And then you look at the statistics, anyway, that is how we got here. And I want you to, just introduce yourself and let's see, and take it away. Yes, you go ahead, man.
Thank you very much, Dr. Uvo. It is always a delight for me to talk about the eyes and to help people keep their eyesight. I keep telling my friends and my patients, the aim is to keep your vision sharp until the final day of exit here on earth. And so that's why we're having this. And thank you for being interested in the population, in the people, enough to care about their health. We are going to just look at eye disorders and treatments available. There are too many serious matters going on around the world now, but I'm going to try and make these as down to earth and simplistic as possible for really anybody to follow until we just get to the time of questions and answers. Eye disorders and treatments. We're going to look through a short introduction, a brief check on what really are the eyes expected to do before we look at what disorders can be concerning the functions of the eye and treatments available. Then we can have one or two take-home points and we will be able to ask questions if we like to. The human eyes. Really, we all do not have any introduction to the human eyes because we have a pair of human eyes and we see eyes on other individuals. They are just an amazing set of organs. Why do I call them amazing? They are beautiful and they are responsible for what we use to declare something else as beautiful or not in at least up to 80% of cases. Yeah, we talk of inner beauty, we talk of beauty based on what you touch and feel, but I tell you what you see comes out straight, and that is usually what we first talk about. They are prominently located. They are different parts of our bodies. For instance, if I do not smile, usually you do not know where my teeth, you do not see what my teeth look like. But the eyes are just there. They are very prominent. You see someone, you're seeing the eyes already. They are located within the skull. And we know that the skull houses the most important part of the human body. I say the brain still remains the most important part because the brain coordinates every other thing, including the heart that must beat. And graciously, the eyes are present from birth. You see this beautiful young lady with two eyes, and you see cornea down on one eye, down below. Every race has eyes, whether you're black, red, white, orange, we all have eyes. What is the function of the eyes? We're told usually that if we do not know the function of something, the likelihood of abusing it is high, or the likelihood of not taking care of it or neglecting it is high. Just before I talk about the function, we see the eye just like this. In front, you see the lashes, and that's the direct way we look at the eye. But if you look at it in a cut section, where you see the eyeball, the whole eyeball is like a sphere. And it's actually less than 1 1/5 of it that we actually see when we look at the eye. Whatever we see is covered in a little part of it, superiorly and inferiorly, by the eyelashes. The eyes are so important. So the lashes are there to protect the eyes. And the fact that the eyes are located within the bony orbits also confers some form of protection to it. So we have the eye with the anterior part jutting out, which actually shows the cornea. The color of the eye that we see as black, brown, gray, is actually the color of the iris. But because the cornea in front of the iris is colorless, then it looks like that's the color of the eye. And then the white of the eye is actually the sclera, and that extends really back. The eye continues behind as the optic nerve, which takes all the information of what is seen within the eye, what the eye gathers, through to the brain that interprets it, and then we get to understand, oh, I'm looking at my system and I'm reading this off it because it is interpreted. So the eye functions primarily to see, but how does it see? Rays of light from the objects we look at, the intended objects that we want to see, is transmitted through the photoreceptors in the retina, which is at the back of the eye, and all the information in the photoreceptor gets to the brain through the optic nerve, and the brain translates whatever is seen. Why do we have two eyes? Why not one? Some organs are so important in the body, and they're just one. I will give you an example. The heart is just one. The heart is really, really important, but it's just one. The tool we have is not just for us to have spare eyes, but it assists us to have depth, or what we call perception of depth. I can know things in 3 dimensions. I can see in 3 dimensions because my 2 eyes are working together and they work in synergy. So my right eye sees it, my left eye sees it, they both transmit to the brain independently. They overlap at a point. The brain compiles both images, and it helps me to be able to appreciate it in 2 dimensions. So I know I am walking and this is a staircase. I need to get my legs up because my 2 eyes are seeing well. That's an important function and an important reason why we have 2 eyes. So we go to the reasons for the eyes, the functions of the eye, primarily for vision. Vision to see, to appreciate what we see. And this is so important for us in our relationships. You can imagine you see someone and say, why are you looking at me like that? That's because I saw you. So even if you were talking and you were smiling and say, oh, it's amazing to see you, but I see your eyes the way you're looking, there's a discordance. And I can ask, why are you looking at me like that? So it affects the way we relate with ourselves as individuals, with the environment, even for security. You're driving and you're seeing, oh, I can see from my rear mirror, there's this vehicle that is trailing me. Your security is triggered a lot. And when we learn, we have known that we learn better when we use audiovisual devices. I dare say mainly the visual part of it. What you see, you tend to remember more than what is described to you.
Let's go ahead. Dr. Onakpoya, I kind of lost you here.
If a child gets to see, if a child has the eye removed at any age, especially if it is removed at age below the age of 2, if something is not put like a prosthesis in that socket, you will realize that the facial growth on that side of the face will be affected. and that part will be subdeveloped compared to the other side. So the eyes are important for facial growth in life. And of course, what else do we use to convey our emotions as much as the eyes? Expressions, communication, information. In fact, if you are a detective, a psychologist, would want to look at the eye. Yoruba people will say, "Oju loro wa." Even though I can hear you when you talk, but your same speech can mean different things when I look into your eyes while you're speaking.
Quick
And how
question
can
here.
we talk?
Your slides are no longer shared.
My slides are no longer visible.
Yes.
Oh, let's look at that. Maybe network.
I've been listening to you while you're going on with that. You know that the eyes are
Right.
pretty. I mean, I didn't. That's quite a revelation in terms of the eyes being in the socket affects the growth of the face. That's interesting.
Yeah. So can you see my slides now?
Yes. Yes.
Okay. And I was going to just go to the last point on the function of the eye. The eye contributes significantly to the beauty of a face. Just imagine a face without the eyes. You know, for ladies, you know that when you want to make your face look really beautiful and you want to paint it, there's a significant thing you need to do around the eyes because the eyes are important. The eyes help us to appreciate beauty and the eyes contribute to beauty. But then we'll remember very clearly that the eyes are very important in vision. For vision. And when we say the eyes are important for vision, I like to describe it like this. Our eyes can see things that are far from us, we call that distant vision. Our eyes can see things that we bring really close to us, that's near vision. And our eyes can see intermediate vision in between these two. That is very important. Otherwise, we'll be stuck with just one side. When I come out, I can only see what is far. What happens when I read? I dare say that when your eye is looking at far objects, that is actually when the eye is working in its anatomical position. That is, the eye is working at its best and its relaxed position. Our eyes see distant objects at our relaxed position. Depending on where you put your TV in your house and where you sit, that may be it. Or when you're driving, when you're on the road, when you're looking at blackboard, or when you are viewing a projection, or you are walking, taking a walk and looking at the grass, looking at the flowers. Those are examples of distant vision. That is when the eye is working at its relaxed stage. But we know that in life, we get to do near work also, like reading a book, threading a needle, picking beans if you come from my part of the world, reading text messages on your phone and sending the same. Those are near vision. Whenever you need to do a near vision, there are works that go on within your eyeball to allow it to happen. That is summarized and called accommodation. Some muscles need to work more. The shape of the lens within the eye will need to change so that you will be able to do the near work effortlessly, and then you can return back to your distant vision. I will explain how this contributes to our need for help when we age and we start losing the energy and the ability to accommodate. But unlike machines and other issues, the eyes are human eyes. So there are intermediates in between. This is oversimplified to think that all life is about distant and about near. There are things you do intermediate. I'm looking at my system now. It's a little far from me compared to if I was texting. Or if you're drawing, if you're making a drawing on a board, on a table, it is intermediate vision. So really we need to go through all this. Just before I go to talk about the disorders that could happen to the function of the eye, I would like to make mention about the concept of visual impairment. There is what we call the normal vision. That is, my eye is expected to see this far if this size of object is placed there. However, we start saying there is a visual impairment if the eye is not able to see as it is expected to see. And the eye is said to be blind when it cannot see at all. There are specific definitions for this, just to make it easy, so that if I say in Congo that this eye is blind, whoever is in Warri or is in Japan should understand that I'm saying the same thing. And that's why we have the definitions. Visual impairment is if the best eye is not able to see in 30 meters what it should be able to see at so meters. I wouldn't like us to bore us with that. So the eye really can have issues with vision. And really, you should even have noticed that your eyes are present there. I'm sure most of us take our baths, get ready without noticing at all that there's anything around the eyes. However, when an individual starts having things like pain in the eye, excuse me, then you know that there may be a problem. The whole ophthalmic world is concerned about blindness because there is a concept of avoidable blindness. That is, eyes that are blind following disorders that could have been treated or prevented. Those are avoidable blindness. And it is known that 80% of blindness in the world is avoidable. Now, avoidable blindness can be caused by treatable diseases or preventable diseases. There is also the concept of irreversible blindness. That is, once the individual is blind from this disorder, it can never be reversed. And that disorder could still have been avoidable, could be preventable, but once the blindness is there, it cannot be reversed. I want us to have this in mind as we go on to start talking about the disorders. Just before whom I would like to share, before which I would like to share this slide that talks about what we used to celebrate to the World Sight Day last year, October, telling people to be concerned about their eyes at work, things you need to know about your eyes at work. When you have good vision, it helps you to work better. 9 to 10% of workplace eye injuries could have been prevented. Good vision can encourage you to, it can increase your earning potential. And of course, 90% of all sight loss is preventable or treatable. Eye injuries in workplace can lead to visual loss. What are the eye disorders that are known and treatments available for them? Ladies and gentlemen, there are so many eye disorders. I have chosen a few here that are common and that I could talk about while I allow us to ask other questions. There are those called refractive errors, where an individual may not be able to see far, or may have difficulty in seeing near, seeing as much as he should see. And all this can usually be corrected with the use of spectacles. But that will be if that individual knows. This can be so impactful, especially in school children. A school child that cannot see the blackboard, a school child that cannot read what he's writing. So his handwriting is going to be bad. His learning ability is going to be disturbed. Imagine a child living with that in the first 5, 6, 7, 8, 9, 10 years. That would have affected even the most brilliant of children. A variant of it is what we call presbyopia. Remember, I spoke with you about needing to do some work in the eye, needing accommodation to be able to see near. When we get to 36, 37, 38, 40, we begin to lose, the eye begins to lose the ability to accommodate. And therefore, individuals start finding it difficult to read small print or to do work that is near. Things as little as cutting their nails with the nail cutter becomes difficult without pricking themselves and all that, or things as little as threading needles, and would need to use glasses. It is important to assess care, and optometrists and ophthalmologists do a refractive examination and determine the power of the spectacle to use, and therefore the individual gets the corrected spectacles. For young children, you may need to update it as they grow. And for presbyopics, as the accommodation loss increases, then the power needed may change until at about the age of 60, when every form of accommodation would have been lost, and then the full accommodation correction will be given. In our world today, everyone, or almost everyone, uses computer in one form or the other, even in the form of our phones. And there is a lot that is going on that causes digital eye strain or computer eye syndrome. That's a whole huge topic on its own. But I would like us to know that this is as a result of consistent near work. Remember, you are working when you are not looking far off. So when that continues for long, sometimes it affects the eye by making the eye to be open for long without having commensurable amount of blinking, therefore causing dryness of the eye. Or it can also cause what we call accommodation strain. And it is advisable that when you work on your system, you should do it, you should give yourself a time to relax. Take 20 seconds off the system to look at somewhere far off, and after 20 seconds, return back to what you are doing, and do that frequently in between the work. That is giving your eyes rest. Remember, rest for your eye is looking far off. Cataract, this is the leading cause of blindness worldwide, but more importantly in developing countries. What is cataract? There is a lens within the eye. It is transparent and should remain transparent. I use this illustration to tell my patient, imagine putting a brush in a freshly prepared, what starchy milk, can I tell you, pap. I hope we all have an idea what pap is like. Or we can use custard, and you take a brush and you wipe your windscreen. It will cause blood vision. If you add layers upon layer, at some point, you will have no vision through your windscreen. That's what cataract is like. The lens becomes cloudy. And as the cloudiness increases, the vision is diminished until there is no vision at all. So patients have gradually progressive visual impairment, whitish discoloration, and severe glare until they really cannot see with that eye. The good thing about cataract is that blindness, visual impairment from cataract is reversible, provided there are no complications involved in that cataract. So, and the surgery involves taking off the essential parts of the lens and replacing that lens. Because if you take it off, yes, you can remove the whiteness, but you have to replace it with an intraocular lens that can do the work the lens was doing in that place before. And that's essentially what cataract surgery is. I can assure you that it gives a new lease of life. Look, if an individual loses his vision, many times, many things go along with it. Self-esteem, confidence, productivity, and so many other things go along with it. So if a person's vision is from cataract blindness is restored, many of those things are restored, and it's like giving a new lease of life. Cataract is very different from glaucoma, which also tends to occur. Yes, cataract can occur in children or in adults, but the commonest variant is the age-related cataract. Trauma, excuse me, trauma at any age can also lead to cataract. Glaucoma, excuse me, glaucoma, on the other hand, is one of the leading causes of irreversible blindness. Blindness from glaucoma typically is irreversible. Glaucoma refers to a set of optic nerve disorders, a set of eye diseases where there is optic nerve disorder with visual field damage, and raised intraocular pressure is a major risk factor. Too many gamma. In glaucoma, there is increased pressure within the eye. And because there is the only place for the pressure to be let out if the eye is not going to burst is the softest part of the eye. That is the place, the sieve-like space where the fibers that form the optic nerve goes out. So the glaucoma causes destruction of the optic nerve because it does this gradually and it does not affect direct vision initially. It is termed thief of the sight because an individual can have glaucoma and not know. Indeed, it is said that before you know that you're losing vision from glaucoma, up to 70% of vision may be lost. Because, you know, if I'm looking directly at my system, without turning my head, there are places I can see at my side, superiorly and inferior. We call that the visual field. It is visual fields that get lost first. And because glaucoma is commoner with increasing age, indeed we know that glaucoma usually will start from about the age of, about the same time that we need to use presbyopic lenses. It is one of the reasons why we advise that when you need to get your presbyopic lenses, at least the first time, make sure you also screen for glaucoma. It is one of the screenable diseases because it does not give a symptom. However, telltale signs can be seen and the treatment can be commenced so that the blindness is preventable. So blindness from glaucoma is preventable, but it is irreversible. At any point you commence the treatment, you are preventing further damage, not recovery of the vision that have been lost. How can you treat glaucoma? Glaucoma can be treated by medications, meaning eye drops, tablets. Glaucoma can be treated with laser. You can have laser therapy, laser trabeculoplasty, and you can also have surgery for glaucoma under specialist care. What other things can happen to the eye? And now we can say the eye is red, and I can assure you 1,001 things can cause red eye. It can be from infection, it can be from inflammation, it can be from trauma, it can be from infestations. I'll advise that red eye, for my people, I like to say, please, a red eye may be innocuous, can be the regular Apollo, acute viral hemorrhagic conjunctivitis that will run its course and go, but it could also be a herald to a more sinister problem like uveitis that can cause a vision loss. Love your eyes, get it checked when you see what is not supposed to be there. I had mentioned dry eye. This is becoming a lot more problematic to many places, in many places now. People talk of, because of the depletion of ozone layer. I also add that in addition to that, we all use our eyes a lot more on our technologies right now, our phone and all that. So we do not blink as often as we should, and we probably do not sleep as long as we should. So good for you to remember and be kind to your eyes, blink a lot more. And if you are having symptoms of red eye, there are tear supplements, eye drops that can be used. You will remember that I alluded to the fact that we have two eyes so that we can perceive depth. Perceiving depth is so important. For instance, you cannot be a pilot if you cannot perceive depth. You cannot be an ophthalmologist or indeed anybody that works with a microscope because you need to be able to perceive depth, to know that this is the level we are in, and you need to be able to see in 3 dimensions. It's because our eyes are located and coordinated in such a way that the two eyes can be looking at the same object. If I would like to look to the right now, I will have my right eye turn right, and my left eye will also turn right, so that the two eyes will look at the same objects at the same time, because that's the only way I can perceive depth. Occasionally, there is a problem with the muscles that move the eye and their innervation, and one eye is refusing to move along with the other. So we say the eye is deviated. That is where we have issues like squint, or also called strabismus. And that's an issue that should be presented in the hospital. There are many things that can cause that. It can be so turbulent, especially if it is of recent onset, and the individual may not be able to see, maybe seeing one object as two, so you don't know which is real. It can cause a lot of confusion, and it can actually affect brain development in little children. So it is worthwhile to go for care for this. Sometimes it can be corrected with prisons. It's then the causative. Sometimes it's caused by systemic problems like hypertension and diabetes, and treatment of those could lead to resolution. All you may need to do is surgery to correct the misalignment of the eye. Ocular trauma is a gamut of disorders on its own. Chemical injuries, mechanical injuries, blast injuries can affect the eye, and that will need to be treated. In fact, apart from age-related cataract, trauma is the second leading cause of cataract globally, and it is the leading cause in young adults, especially young adult males. Diabetic eye disease. That diabetic is increasing in incidence because of diets, sedentary lifestyle, and increased longevity all over the world is not news. But I think the issue is how this affects the eyes. The level of blood sugar control affects the eye, and it can lead to changing in refraction, where an individual, if does not know, can be changing spectacles and can really be frustrating. Aside from that, diabetes is the leading cause of, the leading metabolic cause of cataracts. And there is the troublesome diabetic retinopathy, which is the leading cause of blindness in working age group, especially in the developed world. That is individuals between 20 and 60. I will not go on to be talking about diabetic eye, diabetic control, but indeed, once an individual is diagnosed diabetic, and WHO has it that up to 30 to 40% of persons that are diabetic do not know that they are diabetic. But for as long as the diagnosis is made, each person ought to have their eyes checked at the beginning and every year to exclude diabetic retinopathy. Diabetic retinopathy is a microvascular change that occurs in the eye because of diabetes. And the good thing about it is one of the screenable disorders, because it may not show up as visual impairment or pain, but it is better, cheaper, treated in its early stages so that the individual can see. A study among the diabetics showed that many diabetics would rather die than lose their vision. Some would prefer to lose their foot than lose their vision because they perceive that they need their eyes to take care of themselves. So it is very important. You know anyone that is diabetic, please encourage the fellow to screen for diabetic retinopathy. I am rounding up on these disorders now. I would like to mention retinal detachment because it is one of the emergency cases in the eye. That is when the retina is moved away from its source of fluid, nutrient, which is the choroid. Remember I mentioned that the main structures that perceive the light rays is the photoreceptors. They are within the retina. So when they are moved away from their food, then the eye will not see. And it's usually it can be quite dramatic. It is an emergency. The treatment, the prognosis for good restoration of vision is dependent on how quickly it is, the retina is reattached surgically. So it is important to get to the hospital and have the diagnosis made and treatment done quickly. For diabetic eye diseases, just to mention the treatments available, definitely clear and control of the diabetes, and then use of laser, use of intravitreal injections into the eye, and vitreoretinal surgeries. There are other causes of poor vision Some poor vision can be for near or for far. Poor night vision, as you can see in retinitis pigmentosa. I dare say that it is very important that we love our eyes enough to take note of what is happening and to seek care, or love a community enough to be interested in what you can do to take care of their eyes, like these NGOs do. What treatments can be available? I said that one of the most important treatments is cancer. I just told you about moving your eyes to rest. Eye exercise. During counseling, you get to know that when you do a job that is risky, you should wear protective eyewears to prevent blindness from injury and to know the prognosis of whatever treatments that you are getting. Medications can be useful, eye drops, tablets, injections, and things that we put on, refractive eye spectacles. I'm wearing one now because I'm stressed myopic at 52. Contact lenses, patches, some eyes when, for instance, remember I mentioned strabismus. For some children, because the eye is deviating, the brain of a child is very plastic. So it looks like, look, instead of me to be seeing one thing as two, this eye that is deviating, let me lazy it out and block vision for me. So that eye is not seeing. So once we see that kind of a child, one of the things you do is that there are some patching that is done. You patch the better eye such that that eye cannot see, and the child's brain will be forced to use the eye that it's relegating, because there's nothing that's wrong with the eye. So patches, prisms, surgeries, cataract surgeries to reverse blindness, glaucoma surgeries to prevent blindness, retinal detachment surgeries to prevent blindness, point surgeries to cause realignment, and so on and so forth. Lasers are available to treat glaucomas, diabetic eye disease, and it is some refractive, to correct some refractive errors. What of when the individual is now irreversibly blind? Is that all? No, there are rehabilitations, low vision aids, braille, such that the individual can still contribute to make himself comfortable and not be totally dependent on everyone. In eye care, I join others to say that prevention is very important. And so that we'll be talking of how do you take care of your eye when there's no problem at all. The eyes are just perfect. You don't even remember that you have eyes, other than the fact that because they are doing so well. While your eyes are in good health, please read always with enough light so you're not straining it unnecessarily. I cannot overemphasize the importance of balanced diets. Reduce the sugars and the processed food. Drink a lot of water. Eat green leafy vegetables, fruits. Avoid traditional eye medications or self-medications. Can't but forget a little child that went to boarding house and there was Apollo going on, and somebody felt, let's use urine. They told urine. He did not apply his own urine. He applied a friend's urine who had gonococcal disease, and the child lost, at least one of the eyes was totally lost because it melted the cornea. Gonococcus is one organism that can penetrate a healthy cornea. Protection at play and in workplaces. When children are at play, please protect the children. Corporal punishment should avoid beating around sensitive organs like the eye. And workplace, wear your goggles. I spoke about 20/20 at the screens, whatever screen you use. Every 20 minutes, look 20 feet away for 20 seconds and continue your work. You won't even notice when you get used to it because it's not going to affect your work. You should be very alert to dysfunction. You notice something not like it, please go care for it and go to the right team. You know, you would not like to take your car to a carpenter if you see that it is jerking. So please go to the right doctor. From age 38, you should do an annual eye check. Your vision will be checked, your intraocular pressure will be checked, and your retina will be looked on with a fundoscopy. If you have any complaints, seek specialist attention. Can you assist me to pass the word for diabetic eye screening? Screen the eyes. It is always cheaper on the long run to have a screen. What is our take home? The eyes are a pair of beautiful blessings. We must care for it to avoid blindness. The most important thing about the eye is that it should be able to serve you through life. And it's good to have annual checkup and get an eye care specialist to check your eyes, depending on where you work or you live. May our eyes remain beautiful. You are the most important eye care giver to your eyes because you live with your eyes and you should check. Depending on where you live, an optometrist can check your eyes and can determine when you need to see an ophthalmologist. Or if you have a family physician, complain to your family physician and it directs you straight to an ophthalmologist if you do not have an access to one directly. And there are others depending on where you live. People that live in the villages are probably stuck with community health extension workers, volunteers, as some NGOs get people volunteer to go and check eyes. Eye health educators. Geez, I'm just educating you about the eye health now. I mean, I could do this. Somebody else could have done it. Nurses, ophthalmic refractors, and some of us are parents. Check your children's eyes and pay attention to them. Thank you for listening all through this. I wonder, Dr. Ovo, if there are questions at this point. Thank you very much.
Thank you so much, Professor Onakpoya, for this very wonderful. I mean, this is going to be a big resource for us going forward. You mentioned something about digital eye strain. I mean, I think that's going to be rampant today because people are always, if you check around now, everybody's on their phone. Can you just go over how can one, because is this something avoidable? I mean, it's like, how do we prevent, is there any way to ameliorate that, eye problem that comes from just looking at screens all day long?
Okay, so for digital eye strain or computer eye syndrome, honestly, I am not sure it's something, I agree with you, it's something that is living with us now because our world currently is dependent so much on the screens. So we are either screening on our laptops, on our tablets, or on our phones. So what we advise is rest the eyes in between use. Blink a lot more. If you're using your system, let your system be placed in such a way that you are looking down on your system. That reduces how wide your eye is open and reduces the amount of time you look without blinking. And if we blink without thinking. Think and blink a lot more frequently. And every 20 minutes on the screen, look 20 seconds away. Look 20 feet away for 20 seconds. Those are the things that can help. And once you start having strain, go check with an ophthalmologist. You may need help with some eye supplements. And that's what assists.
Okay, thank you. Thank you so much. I'm sure there'll be more questions as we go forward, but we're going to be in Agbo, Central Hospital Agbo, for surgeries. How can one, tell us more about how can a patient prepare for pre and post cataract surgery maintenance?
Okay, for a patient that is to have cataract surgery, the single most important thing is for the patient to be aware of the procedure and the reason why you want to do the procedure. The patient should know that the patient has this cataract and you're going to do a surgery. It is usually done under local anesthesia. So the patient should know that, oh, you're going to be Your skin around your eyes will be cleaned with some lotion to make sure infection does not enter the eye. You may be given one or two injections around the eye to deaden that area, so you will feel no pain at all during the surgery. But that it will be required for you throughout the period of the surgery to just lay still. Some patients, once they start seeing during the surgery, they want to start greeting the doctor. So you say, don't say anything. Don't greet your doctor, well done. Whatever discussion is going on within the theater, don't worry about it. And you let the patient know that after the surgery, there is a cut that has been made. You will be given instructions on what to do, what not to do. You will be given eye drops, and you are to wash your hand and apply those eye drops for as long and as frequent as you are told to, so that you give time for the eye to heal. And then you will now have you are expected to have your vision restored, provided there's no other problem at the back of the eye. So the patient is prepared for what is to come and the prognosis and what to do during the surgery, and also post, what information will be given the patient when the patient will be seen again, the eye drops that will aid healing. Even if you are seen, does not mean that the eye drops should not. And then if the patient notices anything, each patient should have a phone number or a contact where they can come to, just in case there is any complaint. We all wish and pray that there be no complications, but just in case there be any, so that they know where to go to complain, and that can be easily and quickly taken care of.
Thank you very much. This has been a wonderful time. Thank you for giving us of your time. I know you're a very busy person at the school and your family and your church. Well, thank you so much. And I look forward to doing more programs with you in Ile-Ife and around the area where you are. I'm looking forward to a wonderful 2024. God bless you, madam.
Thank you very much. It's a pleasure.
Okay, have a good. All right. This concludes our talk on the eye. You can replay this. She has said so many things. This is going to be an invaluable resource for you and your family and folks who are going through any problems with your eyes. I'm looking forward to being a part of your solution. God bless you and have a wonderful day.
It's